A devastating blow to public health has been dealt, leaving many concerned about the future of disease control and prevention in the United States. With recent cuts to the Centers for Disease Control and Prevention, CDC, a vital agency responsible for safeguarding our nation's health, some fear we are ill-equipped to handle potential crises. The Trump administration's push to reduce the federal workforce during the government shutdown has resulted in the termination of around 600 CDC employees over a long weekend. This chaotic process began with over 1,300 employees receiving termination notices on a Friday, only to have around 700 of those notices revoked the next day. Erin Nelton-Backus, a health communications specialist with the CDC's Office on Smoking and Health. She and others are left confused and frustrated, questioning the rationale behind these cuts. But here's where it gets controversial. The Department of Health and Human Services, HHS, attributes the firings and rapid rescinding of notices to data discrepancies and processing errors. However, the National Federal Workers Union is challenging the legality of these layoffs, arguing that they are a callous attack on hardworking Americans and a threat to the health and safety of communities. The recent cuts are part of a larger trend, with the CDC losing around 3,000 employees, or a quarter of its staff, since January. This has disrupted long-standing support systems, such as the elimination of the entire staff of the CDC's Washington office, leaving congressional representatives without direct access to the agency they fund. Dr. John Brooks, a retired chief medical officer for the CDC's Division of HIV Prevention, warns that these cuts undermine the nation's public health infrastructure. He believes the Trump administration's actions have eroded our ability to respond to public health emergencies, leaving us unprepared for potential outbreaks or disasters. State and local health departments, which traditionally relied on the CDC for support during crises, are now left without this crucial backup. Dr. Karen Remley, a former CDC official and health commissioner for Virginia, sums up the situation starkly. Now there's nobody to answer the phone. In response to these concerns, Andrew Nixon, Director of Communications for HHS, describes the federal health infrastructure as a bloated bureaucracy and states that HHS is streamlining the agency for the American people. This controversial interpretation of the situation leaves many questions unanswered. Are these cuts truly necessary, or are they a misguided attempt at efficiency? How will the loss of CDC staff and expertise impact our ability to respond to public health challenges? What are your thoughts on this matter? Do you believe these cuts are justified, or do they pose a threat to our nation's health and safety? We invite you to share your opinions and engage in a thoughtful discussion in the comments below.